Thank you for joining me once again on this program, Health is Wealth on Hill Media Africa. Today we are talking about how to sustain a healthy eye. The eye is the most important organ of the body. It is the main source of sight. Thus the popular adage, the eye is the king of the body. It leads and others follow. Everyone relies on the eyes to see and to make sense of the world around them. It is very important to take proper care of the eye, just like other parts of the body. There are simple measures you can actually take to keep your eyes healthy, such as eating a balanced diet, wearing of sunglasses to prevent sun rays, wearing of anti-reflective glasses during screen time, giving your eyes some rest, and also avoid rubbing of the eyes to prevent infection and irritation. Poor eye care can lead to eye diseases and loss of vision. Yes, some of these eye diseases include glaucoma, cataracts, retinopathy, amblyopia, macular degeneration, etc. These eye diseases can cause a major defect in the life of a person if the eye is not properly cared for. These eye diseases can occur at any age, even in children, adults, and the old, but most especially in people who are 60 years and above. Here with me is an optometrist who will educate us more on a specific eye disease called glaucoma. Please don't go away. Health is wealth. You're still watching Health is Wealth on Hill Media Africa. And with me today is an optometrist from the Imo State University. He is Dr. Ekenze Chigozie, and he's going to share with us some of the health measures and how to maintain a healthy eye. You're welcome, Doctor.
Thanks for having me.
Today, we would like you to describe what a healthy eye is.
Well, the human eye is one of the 5 senses through which we acquire information from our environment.
Yeah.
Aside the ear, the skin, the nose, the eye is very vital for the acquisition of information about us. So the human eye is described as healthy when it is able to meet the visual functions. When someone is able to perform his or her daily activities optimally with the use of the eye, we can describe the eye as healthy.
What are the practices or lifestyles that can cause damage to the eye?
Unfortunately, there are so many harmful practices out there
that
can lead to the damage of the eyes.
Yes.
They include, for instance, the children are in school.
Okay.
The way they play with sharp objects, and you see them, they throw stones, they play with rubber band, and in the course of using those things to play, they use it to hit their pears and they end up damaging the eye.
Yeah.
Then when you come to workplaces, especially the artisans,
yes,
they engage in so many harmful practices to the eye. For instance, those ones in the mechanic garage, you see them when something enters the eye, you see them using fuel to wash off.
Yeah.
Very harmful. Those in our villages who may not have access to modern eye care, you see them, they make use of herbs when they have issues with their eyes. Ignorant mothers, you see them when their babies develop problems with the eye, you see them administering breast milk.
Yes, that's true.
They feel the breast milk is a medicine for the baby.
Yeah, they say it helps to clear debris from the eye.
That is very, very wrong.
Oh, really?
As an adult mother, can you take your own eba and put in your own eye?
No.
The breast milk is the baby's food, so why put it in the eye of the baby? This is a harmful practice. Sometimes by divine providence, the baby recovers, but it's not that the breast milk was what cured the baby.
Okay.
No. So it is a harmful practice.
Moving ahead, Doctor, we want to talk about glaucoma, because we heard is a very dangerous eye disease. So we want to educate the public about the dangers, the management, and possible cure. So can you tell us what glaucoma is all about?
Glaucoma is the leading cause of preventable blindness. Among the causes of blindness, we have some that can be prevented and some that somehow we cannot prevent them to some extent.
Okay.
Now, glaucoma proper simply means a group of eye conditions. It's not just a single condition.
Okay.
It's a group of conditions in the eye that leads to the damage of the optic nerve. The optic nerve is located at the back of the eye.
Okay.
It is the nerve that connects the eye to the brain, transmitting information about the images that the eye captures to the brain.
Okay.
Actually, we see with our brain. We don't see with our eye.
Really?
Sure.
Good to know that.
Seeing takes place in the brain. The eye only captures the image of what we are seeing, what the visual world. The eye captures the image and sends the uninterpreted image. The eye doesn't know what has been seen. It only captures light that enters the eye and then sends the information to the brain through the optic nerve. The brain then does the interpretation, tells you you are seeing OKK, you are seeing Okafor.
Yeah.
So in glaucoma, there is a progressive damage, gradual progressive damage to this all-important nerve that takes information from the eye to the brain. Unfortunately, the damages to this nerve currently are not reversible. That is the problem with glaucoma.
Okay.
There is just one nerve that can convey information to the brain. And once that nerve is damaged irreversibly, currently there is no medication, no procedure, whether surgical, optical, medical, that can reverse damage to that optic nerve. So it is better glaucoma doesn't happen. So many things are contributory to the development of glaucoma. But principally, it has been observed that high intraocular pressure is the primary cause of glaucoma. By intraocular pressure, I mean the pressure in the eye. The way we have blood pressure, we also have eye pressure. So when the pressure in the eye builds up, the pressure affects the back of the eye where we have that optic nerve heading to the brain. That region of the eye seems to be the weakest part of the eye. So when the pressure in the eye builds up, it affects that weakest part of the eye, which is where we have the optic nerve, leading to progressive damage of the nerve. Then, aside pressure in the eye, we have eye injuries. Eye injuries, for instance, I told you about children with dangerous play. When a stone hits the eye, it can lead to glaucoma. Or even somebody hitting your eye accidentally or through fights, any form of trauma to the eye can lead to the development of glaucoma. Then, heredity.
It's genetic?
Yes. Glaucoma is about 7% hereditary. So if either of both parents have glaucoma, there is about 70% chance that the children will have glaucoma. There are other causes that are seen as minor, like some surgery as a post-surgical complication that can lead to glaucoma. Even some eye diseases predispose to glaucoma. So it's advisable that when you have a particular problem in the eye, don't treat yourself, because that eye problem could be the next step to glaucoma.
That's true.
So you may need to come to us, to the doctors. We treat you so that that problem may not eventually lead to glaucoma.
That's true. You heard it there. Once you notice anything abnormal in your sight, the first step to take is to visit a doctor. Health is wealth. Welcome back. You are still watching Health is Wealth on Hill Media Africa. I hope you have learned a lot on how to care for the eye, especially on ways to prevent glaucoma. Let us know your thoughts on this topic on the comment section. Like and subscribe to our YouTube channel. See you next time, and remember, your health is wealth. I am Goodness Uto. Bye for now.